So Dr. Wallenberg is back in the room, so I think we'll get started. Good morning, I'm Kelly Grover, and I'm the CEO of Cystic Fibrosis Canada, and I met a number of you, I think, at the North American Conference. So I want to thank you for all coming today and welcome you to the 2019 Broken Arrow Conference. We're really pleased that you could all be here in person, and to those of you online, thank you for coming as well. We are so thrilled to bring together such an esteemed group of participants, from people living with CF, their families and friends, to CF healthcare providers and researchers. Over the next 2 days, we're going to learn more about a very important topic: how we can improve the engagement of those living with cystic fibrosis in healthcare and in research. We have an exciting lineup of speakers who will share their thoughts and experience on how we can make a difference in this area. I do want to mention one thing off the start, and that is the use of the term patient. So we know that this word is not one that resonates with all people diagnosed with CF. We also know that some people prefer it not be used because they're not patients, they're more than patients, they're people living with the disease. Please know we recognize the limitations of this word, but for the purposes of this event, you will hear the word patient, and this will be used to refer to those who have been diagnosed or have a diagnosis of CF. Engaging people living with CF in our work has always been a priority for Cystic Fibrosis Canada, and I'd like to share some information on some investments in this area, and in particular share some information on 2 new initiatives. The first initiative provides people living with CF better access to their own health data. We have taken our registry and launched a patient portal called My CF Life Portal. Now, people living with CF are better able to prepare for clinic visits by accessing their personal health data that is stored in the CF Canada's registry. The other initiative enables young people living with CF to take ownership for their own health and care at a young age. Called CF STEP, which stands for Self-Care, Transition, Empowerment, and Personal Growth, this program is geared to children aged 10 plus and engages them in their own care so that they can make a better transition to adult-centered care. We also support an adult advisory committee comprised of adults living with CF to drive forward our information portfolio, ensuring that Canadians living with CF receive the information they need to best manage their health. Engaging patients appropriately in their health care and in their research is a long-standing area of interest that many groups are wrestling with. How do I, as someone diagnosed with a particular illness, become engaged in my own health care or in the research conducted on my illness? How do we do this in the CF space? How do we ensure meaningful participation within our clinics, our research, and our clinical trials? How do we ensure that patient perspectives are considered in our decision-making for funding research? How can we shift our perspectives so that we don't assume we know what patients want? Are we looking at patients as partners? Are we developing and maintaining the programs which benefit patients the most? These are some of the challenging questions we aim to address over the next few days. And it is challenging work, and if someone had all the answers, I know we wouldn't be here today. But I've learned in my almost year here, that the CF community is a very unique group. I know that in this audience and beyond, that we have very committed people who are so dedicated to improving the lives of those diagnosed with CF. And I know we have the innovative thinkers who will be able to drive this work forward and make CF a model for how best to engage people in their own disease. And really, if not us, then who is going to ensure that CF patients are connected and engaged in their care and research? It is incumbent upon all of us to make a difference. I would like to take a moment to thank the support of those who have made today a possibility. First, I'd like to thank our sponsors, Vertex Pharmaceuticals Canada, and I saw some of them over here, and some of them over right here. Horizon Therapeutics, Merck Canada, Gilead Sciences, Mylan, AbbVie, Innovative Medicines Canada, and Trudel Medical International. Thank you so much for your support. It means a lot to us. I'd also like to acknowledge and thank the organizing committee for creating such an interesting few days. And I'd like to thank the CF Canada staff who worked tirelessly to make this event happen. And thank you so much to our speakers and participants. Many have come for long distances, clearly for the amazing spring weather we're having. And thank you for coming to share your thinking and your stories with us. And with that, I'd like to turn it over to Ian McIntosh, our Director of Healthcare, for a tribute to Dr. Peter Drury. So thank you. Enjoy the conference.